The stepped approach to baby reflux. What is it and what are its limitations? It is how the Western medical systems treat babies with reflux. So, the first step is that doctors are told they must reassure parents that reflux is normal. In the US, this is called the watch and wait. Now, reassurance and watching and waiting does absolutely nothing to ease the suffering and pain of any baby in distress or the emotional suffering of us mums watching our babies in this situation and feeling helpless to take the pain away. Doctors will do this for as long as they possibly can. Now, the thing is, reflux isn't normal. If it was normal for stomach acid to be in the esophagus, it wouldn't be so painful. And as I said, doctors are encouraged to do this for as long as they possibly can because research is showing that medication is not really as effective as that reflux doesn't provide better outcomes across the entire population on average. Step two then is that they should advise feeding less more often. So less feeds, smaller feeds more frequently. And then to add thickeners to milks or just to choose thickened milks in the case of babies on formula. Now, the challenge we have is that many babies with reflux already feed really frequently, like every hour and a half to 2 hours. So this advice fails to look at what baby is actually drinking, what it is doing to their tummy, or how they are feeding. None of these have any impact if baby has an allergy either, and can actually make things worse. The recommended time to trial this is for at least 2 weeks to see if it makes a difference. Step three then is an alginate therapy. Typically this is infant Gaviscon, and make sure your baby, if they're on Gaviscon, it must be infant Gaviscon because adult Gaviscon contains aluminium that isn't suitable for infants. Now, alginates cause constipation over 90% of babies. Sometimes it makes the digestive discomfort worse than the reflux ever was. And in infants, it can cause further damage to the small intestine if there is an allergy present. The recommended trial for this is at least 2 weeks. So step four, we're at least 4, maybe 6 weeks in by the time we get to step 4, which is a trial of gastric acid suppression medication. Now, in the UK, doctors have the discretion of whether they choose a histamine 2 receptor antagonist, which is ranitidine, or a proton pump inhibitor. These are the medications that are most popular. So omeprazole, esomeprazole, any of the drugs that the active ingredient ends in prazole. These drugs aren't guaranteed to work and in fact may make things worse, nor are they free from side effects or long-term consequences. In fact, in research that I've done where over 1,500 parents answered a survey I had, less than 20% of parents said that the PPI medication and H2RA medication had a massive, massive impact on their babies, where they rated 8 out of 10 or better. Now, the trial time to recommend this is to do it for 4 weeks before referring to a pediatrician. However, most doctors try one medication, then they try another, then they increase dosages, and they play with medications a lot before they refer to a pediatrician. They might even play with allergy milks before referring to a pediatrician. So when the referral happens, the pediatrician rarely does anything else other than change the medication to another PPI or add in drugs like domperidone, ketotifen, or cetirizine, none of which actually address the underlying cause of reflux. In fact, the underlying cause of reflux is never even looked at under the stepped approach. Doctors never ask the question, what is causing this baby's reflux? And your doctor really can't do anything other than the stepped approach because this is what's laid out in the international guidelines. So what are you to do? It might be time to go beyond the limitations of the stepped approach and start understanding the underlying cause of your baby's reflux. Because when we understand the cause, we can know what action to resolve it for each and every child. This is the work that I do, and I'm inviting you to have another look at the Reflux Free Baby e-course. This is an online course where I walk you through putting together all of your baby's symptoms. I ask you to look at over 80 different things to see what are the patterns that are presenting for your baby, and therefore what action can you take to help your baby outside of the stepped approach that really doesn't ask these questions.